Welcome to the Explainer. Today we're tackling a hidden medical emergency. It might sound small, but you know the consequences can be incredibly serious. This is an air or gas embolism. Think of it like a blockage in a crucial pipe. When this happens in an artery, it's called AGE, and it immediately starves tissue of oxygen. Okay, let's dive into this. How does air even get into our circulation in the first place? Well, it often happens because of rapid pressure changes, most famously in scuba divers. But it can also happen during certain medical procedures, which is known as an iatrogenic cause. Recognizing the signs is the absolute first step in a race against time. And the symptoms? They're often dramatic and neurological, appearing suddenly. And they appear fast. For divers, we're talking within minutes of reaching the surface. Immediate first aid is absolutely vital. It involves managing breathing and giving pure oxygen. But while first aid is crucial, it's really just a bridge to the most important intervention. The answer, according to experts, is hyperbaric oxygen therapy, or HBO. So what's that? It involves placing the patient in a special chamber that increases the ambient pressure. This brilliantly illustrates the clinical pathway doctors follow once they suspect an air embolism. Now, what's really interesting is how it works. It physically shrinks the bubbles and floods the body with oxygen. So let's move to the outcomes and see how this builds a case for HBO therapy. One study showed mortality drops dramatically, from 42% down to just 5% with treatment. And in that same study of over 500 patients, 78% reported a full recovery after getting HBO. This just shows why getting to a hyperbaric chamber quickly is so important for patient outcomes. So the crucial point is that a physical problem, a bubble, actually requires a physical solution. This leaves us with a final thought on how medicine adapts old principles for new challenges.